Today. The purpose of this press conference is to address our mental health system. As you know, Governor Easley gave me clear marching orders back in September when I joined the department, and those marching orders addressed fixing the state's public mental health, development disabilities, and substance abuse services system. In the short time I have been here as secretary, I've noticed often people were talking past each other and not to each other. And so we want to try to change that activity, and today some of the things we will commence, hopefully we'll do that. Each year, 25,000 people are served through our 14 state facilities, and we owe these folks and their families the best possible service. Every dollar wasted is cheating the folks who count on us and the taxpayers. The mental health system is in a state of transformation on a number of levels, and this is very apparent in our psychiatric hospitals. As you probably know, in the past 6 months, inspections by federal and national accreditation organizations have identified operational problems in the hospital which require the department's attention. And we have to restore the public's faith in our facilities, and the actions today being announced will try to do that. We'll try to assure the facilities meet their ongoing responsibilities for providing safe and effective patient care, assure the public that quality services will be provided, and share with them a continuing report of activities in these facilities. And we will look to support current services that are effective and facilitate the development of cost-effective community-based services. We will work to fix these problems that can confront our services, and here's how we're going to try to do that. The department staff responsible for running our state institutions will be moved into my office for at least the next 6 months, reporting directly to me rather than reporting to the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services. A hospital management and operations work group will be convened to work with the state hospital directors. This committee will be comprised of individuals external to the department and will include members from the UNC School of Medicine, Department of Psychiatry, the North Carolina Hospital Association, former state facility managers, a representative from the National Alliance on Mental Illness, and a private provider. This group will review a number of areas in our facilities, including protocols for violence management, for placement of restraints, and administrative guidelines that would be consistently implemented throughout the state hospital system. A thorough review of current operating challenges will be undertaken by this group, including adequacy of qualified staffing and those areas of non-compliance identified by the inspections. Another work group will be established to review the implementation of the state's crisis service system and the state's overall strategy for providing inpatient services across the state. In the crisis service area, the group will review the current implementation activities and refine the definition of the core level of crisis services which should exist in all areas of the state. The group will review current inpatient bed capacities, used and unused, and operational factors which are associated with successful LME crisis services and how to enhance our efforts across the state. The inpatient service area will involve a review of current and program capacities at both the state and community level. It would involve then crafting a strategy for delivering the requisite levels of capacity. This would be a results-driven strategy to guide state hospital construction as well as the community systems. This group will work on issues that involve coordination between LMEs and public-private hospitals in these areas of crisis services, strategies for hospitals to provide inpatient services, and the requisite financial management structure to facilitate implementation. The group will include members from the UNC School of Medicine, Department of Psychiatry, the North Carolina Hospital Association, local management entities, the North Carolina County Commissioners Association, the North Carolina Mental Health Association, and the North Carolina Psychiatric Association, as well as Dr. Marvin Swartz, who would represent the Mental Health Commission as a member of that group and is with the Duke University Department of Psychiatry, and a private provider from the state. We will also be as transparent as possible to improve public understanding of the activities in the state-operated facilities. We will develop an improved website. It will be fully operational by the end of January and will include the following types of information: admissions and discharge data, admissions delay data, inspection survey results and reports, as well as notice when those are ongoing, deaths, actual and trends, significant injuries, staff injuries, new programs, volunteer work, and staff training. We want to be open about our hospitals, so we're going to post all of the news, bad and good, on this site. One thing that I do know is that we have many fine staff at our institutions. We want to do everything we can to make the hospitals a good environment for our employees as well as our patients. To that end, effective immediately, we are implementing a 5% average increase in salaries for psychiatrists in all of our institutions. And we're also undertaking a study to see if there is a similar need to increase pay for our nurses and health care techs in all of our institutions. The closing of Dorothea Dix and Umstead hospitals will be delayed for 60 days to allow for the new Broughton management team to improve operations and to assure sufficient time to address any remaining construction issues with the new hospital. Regarding the new hospital, an external work group will be convened to assess the construction and operational questions associated with opening of the new hospital. The group will meet with the architect and project manager to review these questioned areas. In addition, the group will review the plan for the transition of services from Dorothea Dix Hospital and John Umstead Hospital to the new hospital. We'll have experts from both Duke University and UNC and the North Carolina Hospital Association serving on this group. That is the information that we wanted to share with you.